So when working in theatres and the surgeon requests an esophagostomy feeding tube, these are the pieces of equipment that you will need to provide them with to place that. You will always need a blade. We have O-tube kits. These are a set kit and they live in the prep area in the cupboard that says esophagostomy feeding tubes. We have the feeding tubes. They come in a range of sizes. There's either 14 or 18 French gauge and 75 centimetres and 125 centimetres. When presenting it to the surgeon, as well as telling them the size, make sure you present them with the tube itself, just so they're happy with it and that everything is all okay. And when opening it, we need to be really careful as it's only single packed and it does have a tendency to spring out as it's coiled in the packaging. The surgeon will also need a blade to make the incision to place it, as it does get placed in the esophagus itself. That needs to be done as a sterile procedure, and they will need some suture to suture it into place once it is in position. They will also want a drape for placing it into the esophagus. A drape with a fenestration like that is absolutely fine, and ChloraPrep as we normally would for any surgical site. For dressing the O-tube once it's placed, we need these dressing materials. So the first thing we place is a little antimicrobial disc that goes directly around the stoma site of the esophagostomy tube. We then make a small incision into the melanin dressing. This needs to go silvery side towards the wound itself so that it has maximum absorption. We then use Softban as our primary layer and then Knitfix as our secondary layer to bandage the tube in place. This is done in a figure of 8 motion that the nurses will do. And then last thing is we just need some Surgifix, and this will just hold the tube and all of the dressing in place.